Very good evening to all. Clearly audible and visible, I think. So we are just about to start the session with the help of mixed bag MCQs. We'll be revising the important areas for our upcoming NEET PG 2022 exams. I welcome you all to the session. Clearly audible and visible now. You all can put your queries in the live chat window. So let us begin our session and do give this Unacademy NEET PG Combat to be held tomorrow itself at about 11 o'clock in the morning to avail all these benefits and to assess yourself. So there will be 45 MCQs in this NEET PG Combat session, total duration of 60 minutes, and the questions will be from these subjects: medicines, Dharma, anesthesia, psychiatry, and radio. So do give this Unacademy NEET PG Combat to avail the benefits and to assess yourself. These are the benefits which you will be getting based on your ranks, All India Live ranks. And these are the students who have utilized Unacademy segment and they have benefited for their FMG December exams. And this is a free test calendar for PG exams in particular and FMG exams too on these particular dates. Then with every plus subscription, you all must be aware that you get access to both live and recorded sessions. You can take the benefits of Iconic subscription. You can utilize special classes for your advantage. Then you can raise your hand and you can directly communicate with the teachers during the live sessions. And these are the batch courses targeting our FMG 2022 for June month. Again, a new batch course is starting on 27 January for all 19 subjects. And this is for NEET PG 2022, a MCQ revision sort of batch course. With the help of MCQs and images, all 19 subjects will be revised. And this 2-month subscription is also there right now, which you can avail. Earlier, this was not there. So let us begin with our session. Everyone ready? A very good evening to all. So first question for you all. Let us do some quick revision of the high yield areas. The following image depicts which method of dental charting? Out of option A, B, C, and D. Put your answers. Put your answers in the live chat window. So this is always the right side in dental charting, and this is the left side of the jaw of the person whose charting has been done. So we start from right upper quadrant, and what we have written is numbers 1 to 16 for upper jaw teeth in a clockwise manner. And then for the lower jaw, we go from left sided lower quadrant and we come to right sided lower quadrant. So 17 to 32 for lower jaw teeth. So this is a notation of permanent dentation. But what is the method? The method is universal Cunningham method. So C option goes as the correct answer. What is universal Cunningham method for temporary dentition? In temporary dentition, we have 20 teeth, 10 for the upper jaw and 10 for the lower jaw. So universal Cunningham method said that we will start from right upper quadrant, but we will denote 10 teeth of upper jaw with the help of alphabets. So like alphabet A, B, C, D till J for upper jaw, and then in a clockwise manner with alphabet K to T for 10 teeth of lower jaw. So this is your universal Cunningham method. This is the complete name. What is this? The following image depicts which method of dental charting? What is this one? This came as a repeat question in your AIMS exam in particular. 2 months, two years before. Correct answer goes with the moment you see a plus sign for upper jaw and minus sign for lower jaw. There is plus sign for upper jaw and minus sign for lower jaw. The method of charting becomes, why everyone is answering D? This is not FDI method. The moment you see plus sign for upper jaw and minus sign for lower jaw, the method is not D, not D. The method is always header up. Let us do a quick recap. Header up method for temporary dentition as well as permanent dentition I will be making here. Okay. So for temporary teeth, header up said that I will divide the jaw into 4 quadrants and then I will denote the teeth with the help of numbers. But 0 before the number will make the teeth of temporary dentition with plus sign for upper jaw. Similarly, plus here, plus here. Are you noting the location of the plus sign? So for right sided, this is always right side in dental charting. This is left side in dental charting. So the moment you see plus 0, 1, what is the full information? What is this teeth according to header up method of dental charting? Suppose this question comes in your exam. Plus written to the right of the number with a 0 before the number. Give the full information of this teeth. Which teeth is this? So yes, the moment you see a 0, it is temporary teeth. The moment you see a plus sign means upper jaw teeth. And location of the plus to the right of the number means right sided teeth. So right sided, upper jaw, temporary, and the first teeth will be central incisor. So this is the full information which we are getting. The moment you see that teeth is denoted like this means the teeth is belonging to the left side because plus sign is to the left of the number. So this is another information given in the by header up method of charting. And for permanent teeth, header up said that I will use just the numbers like plus 1 till plus 8 for upper jaw and minus 1 till minus 8 for lower jaw. But see the location of the plus and minus signs. Location of the plus sign to the right means right sided teeth. Location to the left of the number means left sided teeth. All of you understood this, I think. Okay. So don't mark anything wrong. Next time they can ask you this full information by this teeth which has been denoted by header up. So you'll be answering that correctly. Next one. The following image depicts which method of dental charting? ये कौन सा है? Which is this method of dental charting? This is the method which we are taught in our second year MBBS most commonly. The most common method taught in second year MBBS during the practicals. This is your Palmer's method. The moment you see numerical digits have been used to denote the numbers. So this is a notation of permanent dentition again, because you are seeing 8 teeth in each quadrant denoted by numbers. Okay, clear? So this is Palmer's notation of permanent dentition. And for temporary, what was used by Palmer's? Numbers or something else? For temporary teeth notation, Palmer's used which of the following? Numbers or alphabets? Or something else? Very good, very good. Alphabets. Alphabets A, B, C, D, E. Then again here A, B, C, D, E. All the 5 teeth of each quadrant are denoted by alphabets, means temporary teeth notation by Palmer's method. What is this method of dental charting? So in a way we have revised all the methods of dental charting which you tend to forget. आंसर बताओ इसका क्या होगा? अब तो आंसर बहुत सिंपल है. मान लो आपको कुछ भी नहीं पता है, बट इफ यू हैव अटेंडेड द सेशन फॉर लास्ट 5 minutes you will be in a position to answer this question. The following image depicts by ruling out the options. So Palmer's we have covered, header up we have covered, universal Cunningham we have covered. The answer of consensus will be yes, FDI method. What is full form of FDI? Federation of Dentaire International. And this is considered to be the best method of dental charting. Why? Because every teeth, be it permanent variety, be it deciduous or temporary variety, every teeth gets a unique number. And how it is, how the FDI method goes on. So they said that divide the jaw into 4 quadrants. This side is always right in dental charting. This side is always left. For permanent teeth, they said write 1, 2, 3, 4 in a clockwise manner, just like the movement of the clock. And then go on making it 11, 21, 31 and 41 and go on increasing the number by 1 to denote all the 8 teeth of every quadrant. Every teeth is getting a unique number here. For temporary dentition, they said let us write 5, 6, 7, 8. It is actually, I will write here, it is actually 5, 6, 7, 8 in a clockwise manner. And then go on making the numbers like 51, 61, 71, 81 and increase the teeth by 1. So 51 to 55, 81 to 85. Every teeth is getting a unique number. That is why this is considered to be the best method of dental charting overall. In a nutshell, we have revised all the methods of dental charting. Let us move on to next. Answer this one. Elimination of which drug is enhanced by alkaline diuresis? Multiple times this question has been repeated in all PG exam. Multiple times. So one thing is very clear that alkaline diuresis will be done by giving IV alkaline thing, which is used as sodium bicarb, soda bicarb, NaHCO3 along with a diuretic agent. And this will be used, this will be beneficial for mildly acidic drug poisoning. So what is the list of that acidic drugs for which alkaline diuresis will be useful? So you should always remember this complete list of acidic drugs. Correct answer here is option B. So let us revise the list also of the acidic drugs where alkaline diuresis will be beneficial. So this comes as M for methotrexate, N for NSAIDs, then your S for sulfonamides, then your B for barbiturates, not benzodiazepines. Barbiturates have a alphabet, so they are acidic. Then your P for penicillins, penicillin group of agents, and C for chloropropamide. Chloropropamide. Your most important agents which are acidic and which come in the options. One of the important barbiturate agents is your phenobarbital, which is usually the answer of choice. So any of these acidic drugs, what will be beneficial is alkaline diuresis. Next one. According to Transplantation of Human Organ and Tissues Act, shortly called as THOTA, Transplantation of Human Organ and Tissues Act, which doctor is not authorized to declare brainstem death? Pick the answer of choice. A repeat question. कौन सा डॉक्टर वो टीम मेंबर नहीं होता of brainstem death certification? There is a team of 4 doctors. Which doctor is not the team member? Answer is the doctor who will do the transplant himself. He cannot be the team member of brainstem death certification, because after certification only transplantation is allowed. So liver transplant surgeon cannot be a member. Simple question. Even if you don't know, you can pick the best answer by applying your logical reasoning. Answer this one. Police goes to crime scene and finds some red color stains. And I'm again and again telling you will get one question from this topic again. Don't mark this any question from this topic of trace evidence and stain analysis wrong. So answer batao iska. What is the correct answer to this? Always focus towards color, which I always tell in my classes too. Always focus towards color. Always focus the color of the sample. And you will pick your answer very, very quickly, and that too accurately. The moment you see brown color crystals and the sample, suspected sample to be red, boyfriend test cannot be your answer, because a boy will have semen sample. So boyfriend test cannot be your answer. These are the two microscopic tests for seminal stain analysis. Barbarios and Florence means boyfriend. But our TT bat is red in color and black in color. So TT tests are for red stain sample. So this is how you exclude the options. And then try to recall in Teekman's what you get, brown rhombic crystals. So the answer of choice becomes option A. In Takayama, what is the color and what is the shape? Pink feathery crystals. So it is not pink color, it is brown color. So answer will be Teekman. The same output, brown color rhombic crystals, but instead of red, suppose here what is there is white color stain sample. Will your answer change or will it remain Teekman's? Would you love to change your answer or will it remain Teekman's? If the suspected sample is now of different color. So red color microscopic crystal tests are TT tests. So now TT cannot be your answer. Your answer has to be either Barbarius or Florence. So what is the color and shape of crystals in Florence? Brown rhombic shaped crystals in Florence. So now your answer will change to Florence. But if they write that yellow color needle shaped crystals were formed, Barbarius. Okay, clear? Out of Barbarius and Florence, which test is based on prostatic secretions? Barbarius, the crystals are made up of spermin picrate, correct? So the test based on spermin is Barbarius. But what is the source of spermin? The question to be framed other way around. What is the source of spermin? The crystals in Florence are made up of choline iodide. Choline iodide. What is the source of spermin in Barbarius crystal test? Picric acid we add from outside. Sample has been given to us. But what is the source of this spermin in the sample? Prostatic secretions or seminal vesicles? So always remember that trick, that prostate is an organ having R alphabet. Seminal vesicle में कोई R alphabet है? नहीं है. So seminal vesicle is not having any R alphabet. So you cannot, seminal vesicles cannot secrete spermin having R alphabet. It cannot be correlated with Barbarios having lots of R alphabets. Answer has to be prostate. Now what is the source of choline in Florence test? Iodine we add from outside in the form of potassium iodide as a reagent. What is the source of choline? Now seminal vesicles become happy that we will also be secreting something in the form of choline. Now which alphabet we should focus towards? L of choline with L of seminal and vesicle with L of Florence. Everywhere you will find that matching. L alphabet to be remembered with Florence, R alphabet to be remembered with Barbarius to make life simple. Okay, let us move ahead. Answer this one. Microscopic crystals as shown in the test. In which of the इसमें so always I tell in my classes also, and here also I will again assert that always remember the color. The moment you see reddish pinkish color, it cannot be Teekmans, it cannot be Florence, it cannot be Barbarius. That way also answer has to be Takayama. In Teekmans, crystals are brown colored, Florence brown colored, Barbarius yellow colored. So it is neither brown nor yellow. Even if you are not able to identify the shape, you can mark your answer, correct? Because it is pinkish reddish. Actually, it is pink feathery crystal. Now do some match the following. Do one matching. Match this lightning. Lightning will match with which of the following options in column B? Lightning will most commonly match with which of the following options in column B? This will be a revision, multiple topics revision. One will match with lightning. Lightning will match with lightning. 30% of lightning cases will show you filigree burns, also called chironographic burns. Lightning most commonly will easily match with D. Okay, one is done. Come to high voltage electrocution. High voltage burns. High voltage burns. What happens? Multiple entry and exit point of current giving rise to multiple punched out lesions so that the skin surface becomes rough, as if resembles the surface of a crocodile. So yes, high voltage electrocution will go with F. Come to hypothermia. What is the definition of hypothermia? Hypothermia is said to occur at a body temperature. Match this option 3 in these terms. Hypothermia defined when the body temperature is less than 32 or 35. Definition is when the body temperature becomes less than 35. So it will match with C. It can match with A also. But if it is particularly mentioned that hypothermia is defined, so when the body temperature is less than 35, we say the person has become hypothermic. What is heat stroke? Heat stroke is said to occur at a body temperature more than 41. So yes, 4 goes with B. Low voltage burns is given another name, that is, it is also sometimes called electric contact points or Joule burns, where you get central necrosed area surrounded by raised borders. So this is complete. Let us move on to next table. Do some match the following. Column A is that few things, legal words, legal in types of inquest or something has been written, and which is to be matched in column B with the respective CRPC sections. All the most important and repeat ones. Karo. Option 1 will match with, this one will match with judicial magistrate inquest comes under which of the following CRPC sections? इसका आंसर बताओ मुझे. I will wait for the reply and let me see fastest finger किसका है. Judicial magistrate inquest will match with which of the following? So many options are there, A to F. ये तो हमें पढ़ना है ना. This we have to read. What are the different types of inquest and subdivisions of 176 CRPC into 176 1A and 1? So judicial magistrate inquest comes under 1A CRPC, subsection 1A. Okay. Come to subdivisional magistrate inquest, or I say executive magistrate inquest. This will come under subsection 1. This will match with B. Then cognizable offense is an offense where police can arrest an accused even without warrant from a magistrate. And this is defined under which CRPC of the following? This is defined in 2 subsection C of CRPC. A will match with this. Police inquest. Police goes to the crime scene to do the investigation under 174 CRPC. So C will match here. This is a repeat all India exam question itself. All these are repeat questions. This division of inquest came in our PGI exams 2 years back. So division of inquest is already a question, the old question. So change of death sentence of pregnant female to life imprisonment can be done by High Court judges when they look after the verdict given at district level, either by additional session or district judge. They are the judges who can give death sentencing. So when the file is given to High Court judge for confirmation, and if he finds that the accused is a female and now she is pregnant too, so they will change death sentence of that pregnant female to life imprisonment under 416 CRPC. So E will match here. Okay. Correct. Let us move on to next one. Answer this one. Yellow color needle shaped crystals are seen in microscope in which test? Now it is the simplest question for today. Now yellow color. Answer. There are 2 tests where brown colors are there, Teakmans and Florence. They cannot be your answer. Takayama, pink color. So your answer of choice will be Barbarios, where you get yellow color needle shaped crystal. Answer this one. Onus of proof in contributory negligence in particular. And let me add one word here to make things simple. Onus of proof regarding contribution. Onus of proof regarding contribution in contributory negligence lies on whom? आंसर क्या होगा? अच्छा एक चीज बताओ, what is contributory negligence? Normally we say that the doctor is negligent because the patient has filed a complaint. This is based on the patient's complaint. Now what is contributory negligence? Doctor is saying that patient was also negligent along with me. Doctor is saying that patient also played some part for his damage. So who will have to prove this contribution thing? The person who is asserting that patient is negligent, he will have to prove this contribution. So it will shift towards which person? It will shift towards the accused person. Who will be the accused person in negligence cases? Negligence case will be like this: patient versus doctor. So normally we say that burden of proof lies on the patient. Burden of proving the guilt of the doctor. This lies on the patient. But burden of proof regarding contribution in contributory negligence will shift on the doctor side. Keep this thing in mind. Now, multiple correct options can be there. So, go on reading or statements A to F and mark true and false. So, let us start with A statement. And now put your answer. Rat hole entry is seen in shotgun weapons. Is it a true statement? Leading question. Yes or no? We will write yes or no. We will write the answers as given in leading questions which are asked during cross examination of a witness. So, rat hole entry is seen in shotgun weapons. Is it a true statement? You all can write only T, just a capital T to save time. So, yes, this is a totally true statement. At which range? Rat hole entry is seen almost at this range, 32, 180 centimeter, which is a sort of intermediate range, medium range, or near shot for a shotgun, where what happens? Dispersion of the pellets leading to central rat hole. Now come to statement B. Rat hole entry occurs at distance of 3200. Yes, this is also correct. 3200 में मिल सकता है rat hole. This is also a true statement. Maltese cross appearance is associated at 50 to 60 centimeter range in a shotgun entry. Is it a true statement? Option C. Maltese cross appearance will be like this: a central rat hole surrounded by X-shape abrasion. I'm making this so that you are able to recall. So this is the shape of Babesia microti 2. In that name, it is said to be Maltese cross abrasions. It is associated at which range in a shotgun entry? Is it a true statement? Option C. Option C is totally true statement. This is the range at which we get. And what is the reason for this blunt injury like abrasions in a firearm case? This occurs due to impact by deformed wad. What is wad? Cardboard or plastic disc present inside shotgun cartridge. So that will also come out, and a defined impact by that deformed wad is seen at this range most commonly. Now come to option D. Range of singeing for a pistol is up to 7.5 centimeter. Is this statement correct? Option D. Option D be true है. Try to recall the table which we cover in our classes, and you will correlate that yes, what is the range of singeing for a pistol? Up to 7.5. यही तो याद रखना होता है. Then you can recreate the whole table. Recalling na? What is close shot for a shotgun? Till the range of singeing, we can say that the shotgun was in close shot. What is the range of singeing, or either way around, I can say close shot for a shotgun? Up to 30 centimeter. Yes, this is also a true statement. And is blackening and tattooing present in intermediate range shots? Are they present? Again, the answer is true. So yes, this is also true statement. What is absent in intermediate range? Singeing. Singeing is present along with blackening and tattooing in close shot. Singeing gone, The range becomes intermediate. Why? Because if tattooing and blackening is present, tattooing becomes absent, the range becomes distant short. All the statements are true statements of the following. All the statements are true statements. Again, do a true and false. Gunshot injury may cause which of the following? These are multiple options. Pick your answers. Last question for the day. Gunshot injury may cause which of the following? After using a firearm weapon, which of the following is possible? Pick your answers. क्या क्या possible है? Multiple options can be correct. The question is multiple correct options. एक से ज्यादा ऑप्शन करेक्ट हो सकते हैं. Gunshot injury may cause. अच्छा ये बताओ, प्रोटोटाइप ऑफ अ राइफल्ड फायरआर्म एंट्री वुंड आपको याद रहते हैं? What is the prototype of a rifled weapon entry wound? This is the entry wound which is round in shape. This can be surrounded by black color grease collar. This can further be surrounded by contusion collar and abrasion collar. पढ़ा है ना आप लोगों ने? This is suppose contusion collar, this is abrasion collar, this is grease collar, this is entry wound. The case sequence from outer to inner is the prototype rifled entry wound. So yes, contusion can be seen. Gutter fracture. Gutter fracture is produced by tangential gunshots only. So yes, this is also true. What is bullet pipe? Another name for grease collar. How is grease getting deposited around entry wound? Grease is used in barrel for lubrication. It is used inside barrel for lubrication. If a bullet is coming out and this bullet gets a spinning motion due to lands and grooves, so it will take the grease with it and it will deposit around the entry wound. So yes, another name for grease collar is dirt collar or bullet pipe. This can also be seen. What is beveling? Beveling is unsupported skull table shows you beveling. Yes, beveling can also be seen. What is rat hole wound? Rat hole wound is a irregular shape entry wound, can be seen in gunshot cases. So all of the following can be seen. तो इतनी नाइंसाफी क्यों कर रहे थे आप लोग ए ऑप्शन के साथ और सी ऑप्शन के साथ? Everyone was answering option B, D, E are true. ए और सी नहीं होता है, ए और सी भी होता है. All of the following can happen in gunshot. ठीक है? It was easy to revise, like recall हो जाना चाहिए. So that's all for the day. And tomorrow also and day after tomorrow also we will have these sessions at the same time 7 to 7:30 p.m. In the live sessions. All sessions will be live sessions. So tomorrow and day after tomorrow be prepared for some other mixed bag questions. Hello then, bye bye.